Schwartz, how are you feeling? About the same? Still having some belly pain?
Yeah.
All right. The doctor has ordered for some IV fluids for you, so I'm going to be starting an IV in one of your arms, all right?
Initiating a peripheral IV is a nursing responsibility. The patient's comfort, safety, and ability to remain as active as possible are important considerations in your planning. An understanding of the indications for therapy and how it will contribute to your patient's care is essential. To help in your planning, consider the following questions. What are your patient's baseline vital signs and fluid and electrolyte status? What are the indications and goals for IV therapy? What type of IV fluid has the doctor prescribed? What type and size of vascular access device is appropriate for administering your patient's IV therapy? And which is the patient's dominant side? As you prepare to initiate IV therapy, be sure to check the physician's order carefully. It should include the type of IV solution, the rate of infusion or volume of fluid to be infused over a specific period of time, and any additives or medications to be added to the fluid. Always compare the fluid you receive with the physician's orders. The supplies you need to initiate IV therapy include the following: a proper IV access device for venipuncture, which in this case is an over-the-needle catheter, an IV start kit, which may contain a sterile drape, cleansing solution, and a small roll of sterile tape, transparent dressing, antiseptic swabs, an administration set with appropriate micro or macro drip tubing, disposable gloves, the IV fluid, and a towel. As you gather your supplies for Mr. Schwartz's IV therapy, check the IV fluid to be certain the expiration date has not passed. Also, look at the color and clarity of the fluid, and check the bag to be certain there are no leaks. Before beginning your care, wash your hands thoroughly.
Let's go ahead and get your IV bag ready. Good.
Then prepare the IV fluid bag and administration set. Remember to keep the tubing port and IV insertion spike sterile. Be sure the tubing is completely filled with fluid and that any air bubbles are removed. Use this time to explain the procedure to your patient and how he can be of assistance.
Mr. Schwartz, I'm going to begin to look for the best place, the best vein to place this IV in, all right?
You may choose to apply disposable gloves at this time. However, some nurses find it easier to locate a vein without gloves.
You haven't had any surgery on this side of your body or this arm, right?
Identify an accessible vein for insertion of the IV catheter.
No bruising?
The cephalic, basilic, and median cubital veins are preferred sites in adults. When possible, use the most distal site in the non-dominant arm. Apply the flat tourniquet around the arm 4 to 6 inches above the potential insertion site to evaluate the vessels in the area. Do not apply the tourniquet too tightly, which may cause injury or bruising. You should be able to palpate the radial pulse, as the tourniquet will impede venous return but should not occlude arterial flow.
We'd like to place the IV so that it's not at a place where you bend, so it's not in the bend of your arm or at your wrist.
Use critical thinking skills while assessing for an appropriate site for venipuncture, avoiding sites that are compromised or could result in damage to the vessel.
Down a little bit.
Sites to avoid include those that are distal to previous venipuncture sites, veins in the antecubital fossa and inner wrist, sclerosed or hardened cord-like veins, sites of infiltration, phlebitis, or bruising, and areas of venous valves or bifurcation. Also avoid fragile dorsal veins in older adults and vessels in an extremity with compromised circulation, as in cases of mastectomy, dialysis graft, or paralysis.
Let's bring your arm just down a little bit.
Place the extremity in a dependent position. Palpate the vein by pressing downward and noting the resilient, bouncy feeling as pressure is released. Always use the same fingers of your non-dominant hand for palpation, as they tend to be the most sensitive. If you have difficulty identifying a site, you may be able to promote venous distension by one of several techniques. For example, stroke the extremity from distal to proximal below the proposed venipuncture site. Have your patient alternately open and close his fist, or apply warmth to the extremity for several minutes with, for example, a warm washcloth. Avoid vigorous friction and multiple tapping of veins.
Mr. Schwartz, I'm going to release this tourniquet just while I cleanse the site for the IV.
Release the tourniquet temporarily when you have identified a good site for venipuncture. Make sure the cap needle adapter end of the infusion set is near the patient. Be sure to apply gloves. Cleanse the site using an alcohol swab. Use friction as you cleanse from the center outward in a circular motion. Let the alcohol dry. Then cleanse with an antiseptic solution using the same circular technique and let it dry.
And we'll let that dry.
Avoid touching the cleansed site and allow each solution to dry thoroughly.
All right, I'm going to replace the tourniquet again.
Reapply the tourniquet. Then perform venipuncture.
A bit of a squeeze from their tourniquet.
Stabilize the vein below the site and pull the skin taut opposite the direction of the venipuncture. Have your patient relax his hand. Tell Mr. Schwartz he will feel a sharp, quick stick. Puncture the skin and vein, holding the catheter at a 10 to 30 degree angle slightly distal to the site of venipuncture. Observe for a flashback of blood in the catheter's flashback chamber to determine that the catheter has entered the vein. Lower the catheter until it is almost flush with the skin and slowly advance it another 1/4 inch. Advance the catheter off the stylet until the hub rests at the venipuncture site, and release the tourniquet with your other hand. Apply gentle but firm pressure with the index finger of your non-dominant hand, then remove the stylet and connect the needle adapter of the infusion tubing set without touching the point of entry.
All right, does that feel comfortable?
Open the regulator on the IV line to begin the intravenous infusion. You want the insertion site to remain patent, and any delay in beginning the infusion could result in clot formation at the catheter tip. Secure the catheter as you apply the dressing. In this example, an occlusive transparent dressing is being applied. It protects the site from contamination and permits rapid assessments of the condition of the site. Carefully remove the adherent backing and apply one edge of the dressing. Then gently smooth the remaining dressing over the IV site. Leave the connection between the IV tubing and catheter hub uncovered.
As we can there. Still feeling okay, your IV? Okay, good. Holding still for me for another minute or two.
Next, fold a 2x2 gauze pad in half and place the gauze under the tubing and catheter hub connection, and cover with a 1-inch wide piece of tape extending about 1 inch from each side.
Comfortable?
Yep.
Okay.
Place a second piece of tape over the lower edge of the transparent dressing. Then make a chevron by taking a 3-inch long 1/2 inch piece of tape and placing the sticky side up under the connection.
Feeling better and moving around in bed.
Cross over the tails of the chevron and apply to the strip of tape. Apply an additional 1-inch piece of tape over the chevron. Curl a loop of tubing alongside the arm and place a second piece of tape directly over the tubing and padded gauze.
And this last piece is going to go further up your arm so that if you pull against it, it'll pull here instead of directly over the catheter.
Then write the date and time of IV placement and the catheter gauge on the dressing. Dispose of your supplies. Place sharps in the appropriate container. Remove your gloves and wash your hands. Then regulate the flow rate according to the physician's orders. Show Mr. Schwartz how to move in bed without dislodging the catheter,
Okay, good.
and tell him to let you know if there is any discomfort at the infusion site or any leakage of fluid.
And we're all finished.
Thank you.
Document in the nurse's notes or the parenteral therapy flow sheet the following information: the number of attempts at insertion, the type of fluid infusing, the insertion site, the flow rate, the size and type of catheter or needle, and the time when the infusion was started.